Hello everyone, my name is Dr. Adrienne Lent. I am an assistant professor in the Department of Kinesiology and Public Health. In this video, I am going to introduce myself, tell you a little bit about my journey on my career path, and I'll also tell you about some of my areas of research that I'm interested in, as well as some of the classes that I teach at Cal Poly. So I am originally from California. I was born and raised in Northridge, California, which is in Los Angeles in the San Fernando Valley. And when I was thinking about going to college, I knew that I wanted to go away from home, at least a few hours away from home. So I ended up getting my undergraduate degree in biology from the University of California at Santa Cruz. I was really lucky that I got to run cross country for UC Santa Cruz. I spent my days going to class. I also worked, and I got to run every day with a group of friends who have been lifelong friends through the redwoods on the beach. And running was just really a part of my life. It's still a big part of my life, but in college, it was a really big part of my life. And living in Santa Cruz, it's a wonderful place. If you haven't been, I highly recommend that you visit at some point. But it's a place where healthy living is really easy. There's a lot of fruits and vegetables. There's beautiful places to go walking, to go hiking through the redwoods. It's pretty safe as well. And so this was kind of my everyday life, was living in this place that was just beautiful, and it was really easy to live a very healthy life. And as I finished my degree at UC Santa Cruz, I ended up moving to New York City, which was a pretty big culture shock, given that I spent my days, for 4 years running through the redwoods and eating fresh fruits and vegetables, which were relatively affordable and easy to access. Moving to New York City was just a huge culture shock. It was difficult to be physically active. Some of the areas of New York City at the time were not the safest, so it was hard to run by myself. It wasn't as runner friendly. There weren't a lot of green spaces like there were in Santa Cruz. Also, access to healthy fruits and vegetables became really challenging. So there aren't like big grocery stores for a lot of people in the city like we're used to here in California. A lot of people go to the little bodegas, and those little bodegas had some fruits and vegetables. They were really expensive. So it used to cost like $8 for a little pint of strawberries. And those strawberries typically were kind of mushy and moldy at that point. So things tended to be kind of on the borderline of being expired, and they weren't particularly appetizing. So it became really difficult for me to eat healthy. I also noticed that, a lot of kids would get out of school and they would all go to the same place. They'd go to this McDonald's in our neighborhood, and that's what they were eating every day after school. And I had this realization that where you live really affects your health and your ability to live a healthy life. And at that point, I was an adult, and, it was going to affect my health as an adult. But I also was able to see firsthand, if you're eating these kinds of foods, if you're eating McDonald's every day, those are health effects that are going to start as a child, and those can really linger and last into adulthood. So I became really interested in the area of public health. I wanted to learn more about interventions to address these kinds of challenges, as well as policies. So I ended up applying to, and I got into a Master's of Public Health program at the Claremont colleges. So Claremont Graduate University, which is the graduate school within the Claremont colleges. I got my Master of Public Health, and at the same time, I also got my Master of Business Administration, or my MBA. If you're interested in healthcare management, it's a really great route to go. You can get your MPH and your MBA at the same time. It is a program that some universities offer, and if you ever want to talk about that, I'd be happy to talk with anyone interested in pursuing that kind of degree path. While I was there, I was really fortunate that I got to complete what's called the Randall Lewis Health Policy Fellowship. Randall Lewis is the gentleman in the middle of this picture. He's actually a big real estate developer. And if you know where Claremont is, it's kind of on the outskirt of LA County. It's that last city before you go into San Bernardino County. And a lot of the work that Randall Lewis does in terms of real estate is in the area known as the Inland Empire. So that's San Bernardino and Riverside counties. Those areas tend to have some disparities in terms of health outcomes compared to other areas of California. And Mr. Lewis really wanted to do something about this. So he established a fellowship that placed public health students in local city government to work specifically on health policy and health programs. So I got to spend almost a year working in a city manager's office on a number of health policy initiatives, as well as different health programs. So I got to work with corner stores in Rancho Cucamonga and helping them provide and sell healthy fruits and vegetables in those corner stores to make sure that those residents had access to healthy foods. There were also programs around improving access to farmers markets and things like that. So a city government is not typically a place you think of public health, but city governments actually have a huge role when it comes to public health. They're often the entities that are responsible for zoning, for deciding what is allowed to go into a city. And so they're really fascinating places that with a degree in public health, you could potentially go work and make an impact on the health of local residents. After graduating from my MBA and MPH, I went on to a job at Inland Empire Health Plan, or IHP. IHP is the big Medicare and Medicaid health plan that serves both Riverside and San Bernardino counties. So Medicaid, if you all don't know, is a wonderful health insurance program that is funded by the government. Typically, to qualify for Medicaid, you have to meet certain income threshold requirements. So I got to work there during what is called Medicaid expansion. So under the Affordable Care Act, essentially those income limits were expanded so more people could qualify. Different types of people now qualify for Medicaid compared to what the situation was before. A lot of people weren't able to qualify for Medicaid. So I got to work in a Medicaid health plan during this expansion and saw this rapid growth of the number of people who now got insurance for the first time. And so I worked in their health administration department on essentially any contract that wasn't related to physician and healthcare provider services. So things like language interpretation services. A health plan has to make sure that their members have access to language interpretation services if English isn't their first language. We also contracted with vendors who would come out and they would install handicap ramps and other ADA compliant features in people's homes to make sure that members who had a disability, those members were able to get to their doctor's appointment. So there's all kinds of other things that affect whether someone can get to those doctor's appointments and they have access to care beyond contracts with just hospitals and physicians. So that was a wonderful opportunity. Health plans are a really great place if you get a degree in public health to go work and apply those public health skills that you get. So after spending some time at IHP, my family we moved to Tucson, Arizona, where I was fortunate enough to get my Doctor of Public Health degree in Public Health Policy and Management with a concentration in epidemiology. And while I was in my Doctor of Public Health degree, I also worked full-time on a number of things, but I primarily worked in cancer prevention and control training programs that were funded by the National Institutes of Health or the National Cancer Institute. So the University of Arizona had a grant from the National Cancer Institute that essentially trained their what are called postdoctoral fellows. So these are people that have a doctorate degree of some sort, and they want to go on to further training before they go into the cancer research workforce. So after their PhD, they essentially go through this structured training program. It's able to train them in additional skills in cancer research, and then they go on to jobs in academia, at universities, at the National Institute of Health, all kinds of different areas. And so I was the research manager. I got to coordinate all of that wonderful research and training. I also want to point out that the National Institutes of Health has these types of training programs for people at various levels throughout the educational and training pipeline. So there are opportunities at the undergraduate level, there's opportunities at the master's graduate level and beyond that, that graduate degree level. So if you're ever interested in learning more about these kinds of training programs and whether you might qualify to apply for one, I'm happy to talk about that with you as well. So as I mentioned, I worked full-time. A piece of advice, if you're thinking about getting something like a Master's of Public Health or an MBA and you're not sure how to pay for it, as a full-time employee at the University of Arizona, my Doctor of Public Health degree tuition was actually covered. It was a lot of work working full-time, but also was very rewarding in terms of helping me not go into further student debt financially. So as I mentioned, most of my work as a full-time employee at the University of Arizona was in cancer. So I mentioned that I worked at the Cancer Center managing those training programs funded by the National Institutes of Health. I also worked for the Arizona Smokers Helpline, or the ASH line, which is a state tobacco quit line for the state of Arizona. Every state has a quit line. It's essentially a free resource that's funded usually through tobacco tax dollars for residents in that state. So if you are a resident of Arizona and you use tobacco and you want to quit using tobacco, you can call the ASH line and you can get free resources to help you quit smoking. Those free resources included a behavioral counselor or a quit coach who works with you one-on-one to come up with a plan to help you quit smoking. And they also help callers get access to medications that can help them quit smoking. In terms of what I did at the Quit Line, I got to work with employers and insurance companies to make sure that their employees and their members had access to a comprehensive tobacco cessation benefit. And so part of providing what's known as a comprehensive tobacco cessation benefit is making sure that people have access to a Quit Line, because using the behavioral counseling and the quit medication together, that is the most effective way to quit smoking. So we want to make sure that insurance companies are covering those kinds of services for their employees. In terms of my research really focuses on the US healthcare system, on health policy, and understanding how those policies have affected access to care, and also trying to understand what kind of barriers exist in terms of access to care, with a focus on underserved populations, specifically in the field of cancer. This is a paper that I published as a part of my dissertation. For my dissertation, I wanted to examine basically what the capacity looks like in rural areas in Arizona to deliver cancer care. And so when I say capacity, what I'm talking about is the number of facilities that deliver cancer care, as well as the number of healthcare providers that deliver cancer-related care, kind of across that whole continuum. So from screening to cancer diagnosis, as well as treatments. And what we found in this research is that basically, there are certain counties in Arizona that are rural counties that don't have any providers that provide cancer care, specifically cancer treatment, but also some cancer prevention services as well. So for example, some of the rural counties in Arizona have 0 medical oncologists. So if you live in a rural area and you end up with a cancer diagnosis, you don't have anyone to see in your entire county. So you might have really long travel times to access that care. This is something that we obviously saw in Arizona with this study, but this is a national problem as well. And so when you think about rural populations, we see a lot of disparities in cancer, specifically rural-urban disparities. So cancer deaths nationally have declined in about the last decade or more, but those declines have been much slower in rural areas. We also see that for certain cancers, the cancer incidence rates or the rate of new cancer diagnoses is lower, but the cancer mortality rate is higher for people who live in rural areas versus urban areas. We also see that sometimes people in rural areas come in and are diagnosed with cancer at a later stage compared to people who live in urban areas. So there's a lot of disparities, rural-urban disparities when it comes to cancer. And so this literal capacity to deliver cancer services might be one of those pieces that really explains why we see some of these differences in cancer outcomes among rural versus urban populations. So there's a lot of work to be done here to solve this issue. It is a complex issue, but this is an area that I'm really interested in working in, and my research has focused on. Another area that my research has focused on has been the Affordable Care Act and understanding the impact of the Affordable Care Act on access to cancer services. So in this paper, I worked with some colleagues looking at national data from the Centers for Disease Control and Prevention. And what we found is that if we looked at the data kind of pre-Affordable Care Act, so pre-2010 and then after, what we saw is that the Pap testing rate, so the rate of Pap tests, so having a cervical cancer screening test, those rates actually went down, while the rates of HPV vaccination, getting the Gardasil vaccine, those actually went up. So we saw this inverse relationship between HPV vaccination and Pap testing kind of pre and post Affordable Care Act, which was very surprising. One of the biggest accomplishments of the Affordable Care Act is that we have the highest number of people who have health insurance now. So we thought that both HPV vaccines and cervical cancer screenings, that both of those would go up after the passage of the ACA. But we're seeing this kind of inverse relationship. And so we're not exactly sure why we're seeing this. It might be that women who have had an HPV vaccine think that they don't need to get a Pap test anymore. We're not entirely sure why, but this is an area that I will be doing some further research in to investigate. And I wanted to share this last paper that I just worked on because it did involve a few Cal Poly students. What we looked at was racial and ethnic differences in health and life insurance denial due to cancer among cancer survivors. So with the passage of the Affordable Care Act, one of the provisions in there was that people couldn't be denied health insurance anymore based on the existence of a pre-existing condition. So that includes cancer survivors, people with a cancer diagnosis. We looked at national data, and what we found is that even after the passage of the Affordable Care Act, people are still getting denied either health or life insurance, and that denial rate is much higher among underrepresented racial and ethnic groups compared to individuals who are white. So we still have a lot of work to do in terms of increasing access to health insurance as well as life insurance, which can be really important when you have a cancer diagnosis. In terms of the classes I teach at Cal Poly, I do teach some intro kind of GE level classes, so Health 250, Healthy Living, as well as 255, Personal Health, a Multicultural Approach. And I also teach some upper level classes as well. So specifically, I teach Health 318, which is applied epidemiology. This is the epidemiology class that you will take after Health 298. I highly recommend taking 318 right after you take 298 because the material does build off of each other. And then I also teach the Health 320 Media and Technology and Health Promotion class, which is a pretty fun class. We learn about different types of technology. You get to actually work with some of the different technologies. So for example, you make a podcast in that class. It's just a fun class where we learn about different types of technology and how you can apply those to health promotion. So if you're interested in getting involved in any of the research that I'm doing, or you want to talk more about careers in health administration or anything like that, I'd be happy to speak with all of you. My email is ablent@calpoly.edu. Feel free to send me an email, and my office hours this quarter are Mondays from 2 to 4, as well as Thursdays from 1 to 2. They are on Zoom, and so the meeting ID is there as well if you want to stop by and chat about anything.